Welcome to Midlife Matters, where we celebrate women's wisdom and wit. I'm Georgian Lussier, your host, and I'm delighted to introduce today's guest, Lucia De Vivo Catalano. Lucia is a board-certified nurse practitioner and an amazing entrepreneur, and she's here to share her story with us. Welcome, Lucia.
Thank you very much.
Delighted to have you here. First, tell us a little bit about your name. You have a lovely name.
Thank you. My name is kind of long. I always make a joke about that I'm 4'11", so I have to have a long name. But it's also a very special name for me because I was given the name Lucia De Vivo because it means light of life. And I was born in 1950 after World War II. And Italy, I was born in Italy, and the country was devastated.
Yes.
So the concept of having some light or having some life was really important to both my mother and my father, and I'm delighted with my name.
Yes.
And I've kept it.
Wonderful. And you've certainly had a lot of light that you've shared with others in your life and continue to do so, including operating 3 businesses in the healthcare related field.
Yes.
Currently you have a non-medical services business, right?
Yes,
you help
it's a
people in their
care
home.
company. Yes.
And so besides people who would need help because of aging, what other kinds of issues cause people to, require those kinds of assistance?
Well, they can possibly have a chronic mental illness that they may require someone to help with shopping, or they may require someone to help them with their daily living as far as bathing, dressing, cooking, possibly transportation. They may not be able to do that, although they may be very young. They may be in their 20s, in their 30s. And also then individuals who've suffered like a traumatic brain injury, and they also may in fact require, whether it's a 24-hour live-in individual, or they may need assistance with bathing and also with skills of daily living, learning how to make change, learning how to go shopping and to make a shopping list. So all those things we're able to provide for these individuals, depending on what it is that they may be needing. But clearly, also the aged population is very much in need.
And who typically identifies the needs of folks?
Well, it may be a physician, their primary care physician. It may be a family member. Also, many times, individuals who may be on Medicaid, and they may have a caseworker, a social worker. Sometimes a senior citizen center may be the referring a source. So it can be really quite varied. Sometimes it might even be the mailman who notices that the mail has not been picked up, or that individuals are not, coming out of their home. They may be receiving meals on wheels, and they're realizing that individuals are not eating. So there's really a lot of different sources. Sometimes they go to an emergency room because of a fall. So, the referral can be coming from many different sources.
Where do you think home care is trending in America? Like, what's happening in that field?
Well, I think it's growing. I think that people are beginning to realize that really, my tagline is that, the health is in your home. And people really do want to stay at home. They want to be able to bring in the resources so that they feel like a very active and integrated individual in the community. Many have had long-term friendships. They may be going to a synagogue. They may be going to a church that they've had a relationship for 30, 40, 50 years. And to really displace them can be very stressful. And, there's something called transfer trauma, where to transfer someone from their home to a different setting can, in fact, be very traumatic. It's the same thing as when we buy a new car. Where the radio switch on and off is, and all of a sudden you have to learn a whole new set of skills, or figuring out how you open, the hood. And that's the same thing that happens, and that can be very stressful to all of us, but it can be particularly stressful to elders if they need to transfer to a different setting.
It's good to hear that people in the community from a variety of points are kind of looking out for each other.
Yes.
As
Neighbors.
much as sometimes life seems like it's getting harsher, that's a wonderful thing to just know that, that web or network sometimes is visible, but yeah.
Actually, the neighbors are so kind to each other that I'm really struck by the enthusiasm and the interest in wanting to be sure that if there is a neighbor, that it may, in fact, especially during the winter, often we'll get calls, and if they know that we're in the giving some services, if we're not there on a day that it's not a regular day, we may actually get a call from a neighbor who says, I saw Mrs. So outside and it's really snowing. I'm afraid she's going to fall. You may want to call or stop by. So people are very interested in their neighbors, are much more caring than I think.
That's heartening.
Yeah, it really is.
Yeah. Now, for 10 years, one of your other businesses, you were a partner in a practice and you provided psychiatric services?
Yes.
So am I correct in understanding that you're APRN, you're board-certified nurse?
I'm a clinical nurse specialist in psychiatry.
In psychiatry,
yes.
Okay. And did that business model help you or inform you about setting up this business model?
It did in some ways. One of the things that we did is I worked with a lot of individuals who had dementia. And even though the dementia could have been, different stages, the one thing that, often they would say that they wanted to be home, or that it was difficult, or family members say how difficult it was to come to visit individuals in a long-term care facility. But the theme was always wanting to be home. Home seemed to always be, at the center of the focus. So after, doing this particular work for 10 years and also working with individuals who had mental illness, it may have been depression or anxiety, schizophrenia. And again, the whole concept of wanting to be part of a community, wanting to be at home, with all the metaphorically speaking, what that represents. We sold the business and I retired, bought a farm, and I thought that that's what I would do. But it kept bringing that back to me, that people wanted to be at home. And so when I realized that I really could not be retired, I'm not happy being retired, I came back and said, that this is the type of company I wanted to start. And it was not an easy start. And lots of things, went wrong. I made lots and lots of mistakes. But incrementally, I began to really understand the focus of this particular business, because it is quite different. It's working with a group of individuals who are not doctors, are not nurse practitioners, are not psychologists, but we're working with nurses' aid, we're working with personal care assistants and individuals who are doing chores. So it was a really major learning curve for me to be able to find a way of educating this staff with the philosophy that I had, or the philosophy that I wanted to bring to my company. And so there was quite a steep learning curve.
It sounds like a big shift from the clinical setting.
Yes.
And shared training and approaches and things that you could more or less kind of count on people having.
Yes. Because
to a different world.
Absolutely. Because I was medical. I mean, I could write a prescription. I could, listen, but there's always that medical aspect. This company is non-medical, meaning that we do all the support things. If the individual who has dementia may have a behavior, now it's how do we deal with that behavior in the context of being at home, in the context of communication, versus let me see what medication we can give. So it really begins to healing is really brought by the connection between the caregiver and the individual who we are caring for. There has to be a real synergy. There has to be a real connection. It's not always easy to accomplish that, and so it was it continues to be a real challenge, because when it really works, it's wonderful. And so that's where I put my energy, is to really educate, our staff to use themselves as instruments of healing.
I just recently stumbled on something called music and memory.
Yes.
People are doing a lot with music to
Yes.
help make that connection.
Yes.
And someone writing about it said one of the hardest things is to actually get the music that the person's going to relate to.
Yes, absolutely.
Right.
Because some music can either, bring about some wonderful memories, or some can also bring about some feelings that might not be as positive. So to understand exactly which music is going to bring this individual some joy or enjoyment or relaxation. So for example, there's individuals who love opera. So if you put in a wonderful opera, that might be very wonderful for that individual. Someone else might find that very disturbing. So it really has to be tailored to the specific needs and wants and enjoyment of that individual.
Prior to the practice we were just speaking about with the psychiatric services, you had a private practice, right?
Yes, I did.
And it focused on women in transition?
And I also focused on loss. Did a lot of work with individuals who had miscarried. They may have had a baby, had a birth, and then the baby died. Or that they may have miscarriage of 4 months, 5 months, 6 months. So there was a lot of issues of loss and transition and, going from being a single person to, being a married person, or going from being a couple to a family. So anything that was an issue, that there was a transition, they were going to another life stage, was something that I focused on and I enjoyed very much.
And that's fascinating. It seemed like there were some issues as well that people might have transitioning from being a well person to an ill person,
Yes.
perhaps heart disease.
Yes. I started my private practice in working as I called it cardiac counseling, because I was a cardiac nurse and in Newburgh General Hospital, and started to realize that individuals, you could fix them as far as, if they had, medication, but that they emotionally, they also needed to accept and transition, and how they saw themselves. If they saw themselves as a cardiac, individual versus an individual who may have had a heart attack, or an individual who might have had bypass surgery, that they were not the disease, they were not that event, but they were much more than that. So that, again, was an area where they needed to integrate the illness into who they are versus making the illness be what identified them as an individual.
Which I imagine when you're thrust into a lot of treatment that an event could cause,
Yes.
that it can be hard to remember who you are.
Yes. And because
In the
usually
midst of
it's a
that.
sudden event,
Right.
all of a sudden you may have, a massive heart attack, or all of a sudden you're told that you need bypass surgery. And lots of times you don't really have time to transition and to be able to really work through some of your own emotion, or the family's emotion, the fear, the anxiety, the sense that, maybe I could be dead. This might, in fact, change my life forever. I may be alive, but maybe I'm not going to have the same normal life that I once had. And so to work through the concept of adjustment, yes, you can have your life back with some modification. Maybe you need to, make some changes in your daily routine, but that your life can be just as, wonderful, or maybe even better, frankly.
Well, certainly that's bringing light into people's life. Right?
Thank you.
And did you find that those lessons learned through working with your patients has also helped you deal with loss?
Well, I too have had, many losses, as most of us have. Brother died at 50 from a massive heart attack. I lost 2 babies, and then my husband died from cancer after a battle of 2 years of battle with cancer, and died at the age of 50. I think that, what brought me through it was that remembering other individuals and some of the things that I said. But the pain, even though you're a therapist, even though you've been and walked and been with other individuals who've gone through this, the pain is very real. And the concept that you may have some of the skills, but it's still very, very difficult. I think losing someone that you're very close to, that you love very much, is a major, it's a major loss, clearly. And so, yes, I think that maybe I was somewhat a little bit off because I had some of the training, because I've had some experiences, but it was not easy.
It's always a personal
It's
journey.
always a personal journey, absolutely. So I don't want anyone in the audience to think that, if they've had a loss, that if they're, and they're in the profession, that somehow they should be better than anyone else. No. We're all at the same place. We
Very
all grieve.
basic
Very
human,
basic
yeah.
human needs.
And you have a very strong entrepreneurial drive, right? With all these businesses, and you couldn't stay retired. Who influenced you the most?
I think my mother. My mother, after World War II, my dad, I think, was in a state of shock. He couldn't believe that his world had kind of fallen apart. But my mother was really much more the pragmatist. She realized that she had children. Children had to be fed, the children had to have clothing, and so forth. And so basically, she kind of took the helm of the family and started a business. And the only thing that she knew was flowers. And so she started a flower business. And frankly, she really thrived and did very well. And growing up, I watched an Italian woman who was able to manage, 20, 30, 40 Italian men and be able to get their cooperation, and in fact, their admiration. And she created a very successful business. And I always saw her as a psychologist because she seemed to always know exactly how to manage her staff so that she, in the end of the day, was able to get done what she needed to get done.
Her name was Antoinette.
Her name was Antoinette,
Beautiful.
Yeah.
So what a legacy she provided to you.
Very strong woman, very strong woman.
Sounds like. About how old do you think she was when she started the business?
It was around 1953. So when I was born, she was 47. So she
Okay.
was been probably almost 50 by the time she started the
Wonderful.
business.
Wonderful midlife
Yeah.
story
Absolutely.
in terms of rising to the
Yeah.
occasion.
She needed to, and it was, for her, as she always said, she became a businesswoman out of necessity.
And what traits and habits do you think help women be successful business people?
I think courage, the ability to be humble, and also the ability to understand that nothing is perfect. Things are always going to fail, but that doesn't mean you don't go back tomorrow and the next day or the next moment and do it again, maybe do it a little differently. Having that perseverance, having that sense of, it's not always going to be simple. And if, as a friend of mine once said to me, if it was easy, everybody would be in business. It's not easy. But I think as women, we understand that. We understand that our body, has cycles, that not every single day we're going to feel well, not every single day our children are going to be doing what we would like them to be doing. So having that ability to always have that courage and that hope in the future and today and tomorrow, I think that really what makes an individual a good entrepreneur.
And certainly having a very strong mom gives you an edge in that
Absolutely.
way, right? To be able to see someone who's done it.
Yeah.
Yeah.
And not be afraid to fail. I think that often I hear women say to me, but, I don't know how to do that. Well, no, but you learn as you go. I mean, I really did not know anything about, non-medical home care company. I read as much as I could, and then I had to just go out and do it and fail. I mean, I was 62 when I started this company. I thought, what's the worst thing that could happen? I could close shop, but maybe I could certainly, help some folks. I could certainly learn a great deal. And have the humility to be able to ask questions, have mentors. Again, I will say, please don't be afraid to fail. Fail is a great, great teacher. I think if we look at great individuals out there, it doesn't come easy. People are not just born geniuses. You learn and you work hard, and you continue to have that faith that tomorrow is going to be a different day, and that maybe you'll do it a little bit differently, and this time it might work.
And do you think having successes to look back on can help you say, well, I was able to do that, even though I questioned myself, so now maybe I can also have confidence I'm going to be able to do this?
It's interesting. My friends always say that to me. Well, you've done X, Y, and Z. But every new venture feels like a very new venture. And so, again, all the questions come, can I actually do this? What do I need to do it? So even though you can look back and say, yes, I've had X, Y, and Z, I'm not sure if it's my own personality trait, but it feels like it's a brand new experience. And so I know that I'm going to have to fail, and I know that I have to learn, and I know that I need to go slowly, and I know that there's a learning curve just about in everything you do. I think what helps is that knowing that financially now I'm not worrying that if I don't make money, I'm going to be not able to pay the mortgage. So from that perspective, I think I don't have the same anxiety as I did when obviously I had 2 children, and it was all on me to be sure that my children were also, we would have college money and so forth. So I think that it's different, but it's still the same, the emotional aspect of of wanting to do something that will bring you joy, but also that, financially you have to make a living, because obviously I was not a rich woman. So there's always those two, especially as a mother, and especially as a mother who hopefully can, move forward and bring their children to a better place. So I think that that's a stress.
Yes.
That I think I see that in the women who work for me. They very much want a lot more for their children. They certainly, yes, they might be CNAs, but they strive to be nurses, or they want to be an LPN, or they want to be, because they want to also show and model for their own children, which I admire them for.
And they have you as a role model.
Well,
Yeah.
well, so I hope so.
Yes. Now, we both enjoyed this popular book series with the mysterious author,
yes.
right? Is it Elena
Ferrante, yes.
My Brilliant Friend is
Yes.
first book of 4,
love it.
right? Love
Yes.
it. I believe strongly that women's friendships are so vital to help us
Absolutely.
navigate ups and downs and
Yeah.
slings and arrows and all the things that life bring.
Absolutely.
And so what roles have other women, other than Antoinette, your mom, played in your journey and your life?
I have been the most incredibly lucky woman in my life, really very lucky, because I've had wonderful friends, like, wonderful friend Maria Pietrantuana, who's been a constant friend and mentor for me. I've had friends like Beth. I've had friends like Nikki. During the time that my husband was ill, it was all my friends who came and brought, food. A wonderful friend, Carrie Somerville, who I went to started nursing with, and Joan Mack. And I can't tell you just how many wonderful women who really, created a circle of friendship for me. Maria was at the bedside with me when my husband, took his last breath. So Gail Lemure. I've had so many wonderful, Nancy Brown, who's been there for me and with me. So I've been, and hopefully I've not left some of my dear friends out, because they've all been really a chain of support for me, and they've woven a network for me that allowed me to feel safe and supported and loved. And without that, I really don't think anything else would really matter. I think that is the most important aspect of my life.
And do you, in your observations, do you think men benefit from the same strength of friendships?
I think they do it differently. I think that we clearly are much more verbal, but I think men do it more by supporting each other, whether it's through sports, whether it's through going fishing, whether it's, playing football or whatever it may be. But they also have a very strong bond, and I think, whether maybe going to church and belonging to some organization like the Lions Club or Kiwanis Club, they do it the same way, I think somewhat differently, but they also really need that network and that support system of other men. Our society just does it a little bit differently. But I see men really needing and searching for that as well.
And in later life, women such as yourself really can bloom. And I think of our experiences, our lessons, our instincts, our skills. I call them our zenith years. We can just pull it all together and really enjoy this stage, which you have said this is a good time of life.
It is a
we're on the
wonderful
phone.
time of life.
So talk a little bit about what makes it such a wonderful time of life for you.
Well, I think that, if I look at where I was as a young woman, I had a lot more anxiety about, will I be successful? Will I be able to finish school? Will I be able to find a job? So it's all will, and versus living in the moment. So when you have all that wanting, I wish I could have said to myself, listen, life is a puzzle. Look at the edges and fill in the spaces in between. And some pieces will not fit. You have to keep trying, and don't worry about it quite so much. Clearly, as a young woman, I did worry about that, and I had a tremendous amount of anxiety about, wanting to be successful, wanting to finish school, going to graduate school. There always seemed to be one more thing to be, another goal. Where now, it's much more about enjoying what I'm doing, really enjoying the moment, enjoying the people who are in my life, enjoying my family, enjoying my grandchild. So it's different, and it's really very, very wonderful. I can be in the present.
One of the Facebook sites that I'm on is called Savoring Your 60s, which I thought, what is an apt name.
It is.
Right.
I'm 66, and I have to say, I'm really very much enjoying. I'm enjoying my daughter, enjoying my son, and absolutely adoring my grandson. And it's different. It's a nice time of life. You know, I feel very alive and very creative. So I am very much enjoying being in my 60s.
So the advice you would give to your younger self is trust that it's going to
work out.
It's going to work out.
Yeah, and really, you know, you may try something that is not going to work or doesn't fit for you. It's okay. There will always be something else you can try. And not to be so anxious, just that it has to work out. It really doesn't. And sometimes the best lessons are when it doesn't work out, that it doesn't end up being the way you had hoped or wanted it to, because in that you learn a great deal.
And certainly your example of starting a business after finding retiring wasn't for you at 62 is a great testimony to, you know, it's worth it. Just keep going because you can just build on things. And I love the way you talk about it's all new when you do something different. So you can't rest on your laurels.
No, absolutely not.
New lessons to be learned.
Yes.
But the creativity certainly, I think, is something that we can really tune into as we get to this stage of our life.
And I think the creativity is like a fine wine. It is so wonderful. It really does give you a great deal of energy and joy. And I'm very, very, very fortunate that I can bring that, you know, into my life every day.
And you can bring that light into other people's life.
Well, thank you.
And I'd like to close with a quote. And I know one of your favorites is St. Christopher.
Yes.
It is better to light one little candle than curse the darkness.
Yes.
I think that certainly characterizes, you know, your story that you've shared with us. And you also have another quote that you like. You want to share the one from Mother Teresa?
Mother Teresa has always said, and I agree with her because, and I quote this to our staff because our staff often says, well, I'm only a CNA. I'm only a personal care assistant. And I quote St. Teresa, who says, there's only very few of us, and I'm paraphrasing, very few of us who can do great things. But all of us can do many things with a great deal of love. And I think when I look at my caregivers, they bring a tremendous amount of love. And in so doing, are doing great things when they take care of individuals who need their help.
That's a wonderful note to end on. Thank you so much for coming on the show.
I appreciate you asking.
Oh, yes. And please tune in to hear other fascinating women on future segments of Midlife Matters. I'm Georgian Lussier, your host, and thanks for joining us.